but I've really started to think about how can we work within the system to really change things and improve the care that we provide. And so that's really kind of where I've started to move towards is doing research project, or when I talk about research projects, it's about how do we improve the clinical care and the clinical things that we can provide, and also thinking about it as a systems level too. Like like as a primary care provider, I know how difficult it is to try to get records from a different healthcare system when they're not on Care Everywhere. And I also have complaints about Care Everywhere and how the formatting makes it really difficult to process at the same time. And so how do we connect better with other healthcare systems? How do we connect the community members that are in independent FQHCs or community health systems and trying to get to the tertiary healthcare systems? How do we link them better and those sorts of issues? And so I've been really attuned to that because that's the research area I'm moving into. But how do I act as a beacon for that? And so I've been working with FQHCs on the south side of Chicago. They often always call me, and I get texts at random times where they're like, I have a patient with dysplasia and they need to get into your colposcopy clinic. How do we get them in there? And so that's kind of the direction it's been moving towards, is I've been like this beacon for people to help get them the care they need.
Very important role.
One of the things about being a family medicine researcher is because we have such broad impact, and because of our central role in serving as an ambassador to communities and really making sure that the patient voice is heard in research, that I've had opportunities to be involved in UCSF's Clinical and Translational Science Institute, and including its research infrastructure network, a collaborative research network, and team science programs. And that's been especially gratifying. And I'm up, and I can think of several research projects that I've been involved in that started with a clinical question, in particular, like the work that I've done in cancer screening around colon cancer screening, when we were trying to figure out how to get more people screened at the family health center, because the nurses didn't have time. They didn't have teamlets in those days, and the nurses, there weren't reminder systems, and people didn't want to ask the patient about cancer screening at every visit. So how could we do that? And a lot of brainstorming with people. And we came up with this idea, well, at least once a year, we could give people the opportunity to get a FIT kit or a colon cancer screening kit at the time of their flu shot. And so we just applied for some money, and then it grew into a big giant series of research projects. And now people are doing this type of work all across the country. So I don't think that work would have happened if I were not a practicing family doctor in the family health center, where we had lots of barriers to overcome. And I think the other way in which being a family physician really informs my research is in the way I conduct research, because we, as researchers, researchers often apply for grants, and they say they have these ambitious ideas about what it is that they want to get everyone to do. And a lot of times it's not designed, it's an afterthought about how this work is going to happen in a clinical setting. So being the director of a practice-based research network, a lot of what I do is trying to help people to come up with realistic designs that can actually be, for research that can actually be done in clinical settings. And beyond that, research that's also going to make a difference. So in my own research, I really try very hard not to be involved in research that's not actually going to have a positive impact on all of the research participants, whether or not they got the intervention, and that's actually going to have a chance to be sustained after the research is done. And I think that's a really unique, for anyone who's in patient care and who really is an advocate for health equity and real change. These are perspectives that the family doctor really brings. And it's an appreciated, other researchers, once they realize this, the people on our teams, they really appreciate that perspective. So I think that's something that we all can bring.
Yeah, I'm just thinking, Christine, you've assembled an unusual group of researchers, at least the other three, because see just to hear you talking and know the work you do and how you approach it. See, the traditional paradigm in research has been, you get your study done, you publish it, and then you expect, people to read it and then change things. And it's not closing the loop and really doing it. And I think all of us are what I'd call really embedded, engaged researchers whose ultimate goal is to see how research can then translate into things being better, whether at the macro system level or in our own practice. So I think that's part of it is I feel we have a deep responsibility to take what we learned from our research and at the very least make sure that helps shape better practice environments at our own local practices. So, or education, as you've asked, Christine. So it's like if I'm going to do this research documenting why a racially, ethnically diverse health workforce is important for better access, better equity, then I better put that into practice in our own like medical school and residency program. Because it's not enough, if you're not, then say, okay, what are we going to do to learn from that and implement changes? Then we're not fulfilling the goal of all this. Same as we started studying, here are better models of primary care. It said, okay, can we get the primary care practices in the San Francisco Health Network and the UCSF Health primary care network? How do we, implement team-based care? How do we study it? How do we make that as what Mike called like our learning health system laboratory, not in an exploited laboratory way, but how do we apply and iterate and understand actually when you start to apply it, what are the next challenges you face? So I do feel strongly like you have to close a loop, and you have to close a loop, especially in your own kind of immediate environment with what you're learning from your research.